Ladies and gentlemen, it is with great pleasure that I welcome you here to the Australian Institute for International Affairs, Queensland. And I'm standing in this evening for Paul Lucas, our president, and it's a great pleasure for me to be hosting this evening. For those of you who don't know me, my name is Caitlin Byrne and I sit on the council for the AIIA here in Queensland. I'd like to begin firstly by respectfully acknowledging the traditional owners of the lands on which we're meeting this evening. For me, here in Brisbane, that's the Turrbal and Jagera people, but of course, many of you are potentially joining us from many different lands across the widest reaches of this virtual platform. In the spirit of reconciliation, let me also pay my respects to elders past and present, and extend that respect to all Aboriginal and Torres Strait Islander peoples, including those here in the audience with us this evening. So again, let me warmly welcome you to this discussion, and we're going to be focusing in tonight on international relations in the first 6 months of COVID-19. And it's incredible actually to think that it's been 6 months. It feels like an eternity that we've been living in lockdown and really thinking about the way that we live and interact. I think this outbreak has challenged just about every aspect of our lives, the way we engage in our communities, in our cities, even within our own families. And the pressures have certainly been wide-reaching. I think we've seen leaders, nations, international organisations come under pressure in just about every respect. So tonight's going to be a really valuable review of what's happened over the last 6 months and how the diplomatic and international relations response has actually managed or responded in this environment. There are a number of people who've been looking at this, but I think we're in no better hands tonight than with Professor Sara Davies, who's joining us from Griffith University, and Sara is a Professor of International Relations in the School of Government and International Relations at Griffith. She's a member of the Griffith Asia Institute. You'll see I'm flying the flag behind me. And she is in hot demand, can I say, right now, because it's an area that she's been studying for a number of years. And if you're really interested, can I suggest, and it may not be coming across all that well, but Sara's book, Containing Contagion, The Politics of Disease Outbreaks in Southeast Asia, is actually an incredibly timely and important publication. I think she'll be drawing on that this evening, but potentially taking the conversation a little bit more wide, looking much more at the global view of the international relations of COVID-19. I'm sure there are going to be many questions for you, Sara, and for those in the audience, please don't forget you've got a little Q&A button down at the very bottom of your screen. Feel free to put your questions up there. Let us know who you are and where you're joining us from in doing that, and I'll come to those questions at the end. But for now, let me hand over to Sara, who is really one of the best internationally qualified people to be talking to us this evening. So Sara, the floor is yours.
Thank you so much, Caitlin. What a generous introduction. My goodness, I really have to live up to that introduction now. Thank you. Thank you everyone who is coming in via Zoom to listen to me. I sincerely hope my internet bandwidth holds up. This is peak usage time where I live at the moment. So if you lose me, I will run around the house and find another place to connect back in, but I'm sure it'll be fine. For that reason, I'm not going to be sharing my PowerPoint, and I do apologize for that. I know some people need visuals, but if you would like me to send you a copy of my PowerPoint, I'm more than happy to do so. So I would like to start off by thanking the traditional elders and of the land on which I am here. So this is the land of the Turrbal people where I am located. And I'd like to pay my respects to their elders past, present and emerging. And I'd like to compliment the welcome that Caitlin gave before as well with my own sincere welcome. I would also like to sincerely thank Lily and David and Paul for the invitation to speak tonight. And I'd also like to thank Caitlin for generously chairing tonight's session. I'd also like to thank all of you for coming on at 6 o'clock on a Tuesday evening to hear about me waffle for what I think has been happening over the last 6 months in relation to the COVID-19 pandemic outbreak. I had a choice in doing this presentation today, whether or not to go very specific and narrow and focus in on a number of countries that, as Caitlin said, I've been looking at for a long period of time now, and talk about how I think they've been doing, and that's primarily in the Southeast Asian region. Or I had the opportunity to talk at broad brush strokes about what I think has been happening over the last 6 months around international cooperation. I've decided to go for the broad brush stroke, and I hope that's okay, because for me, this conversation tonight is going to be about how I am reckoning with my own research and my own position on what I thought I would see in the event of a pandemic and what I'm actually seeing in this one. If you want specific details, or if you've got specific questions, or you think I go a little bit too general, that's what the questions are for. And I've already said to Caitlin that she is to give me a very strict times up so that there's lots of time for questions. So I hope I've got the balance right. But as I said, if you feel like I go a little bit too general, come in with your questions, please, at the end and drill me. So what I wanted to just capture, and everyone starts off like this, but I'm going to tell you why I'm starting like this. So let's go back to the 31st of December 2019. And that was when the World Health Organization received the first report of this suspect coronavirus occurring in Wuhan City in China. Now, a lot of us have read since then the Associated Press report, that brilliant report that was published in June, detailing the next 2 to 3 weeks of what was happening then in terms of the conversations happening within the World Health Organization around the information they knew they were not getting, the direct appeals and attempts to try and get access to that information from within China, and then the internal struggle, which I think is equally important to think about, that was happening within China between Wuhan City and Hubei province and Beijing, and the conversations there between scientists and government officials around what exactly was happening, what needed to be reported, and what did the World Health Organization need to know. And so we know that the culmination of this was by the 30th of January, 2020, the World Health Organization Director General, Dr. Tedros Ghebreyesus, declared this outbreak of COVID-19 a public health emergency of international concern. And that declaration was made 20 days after, which was on the 10th of January, the World Health Organization had first reported that they had not only confirmed this was a novel coronavirus, but there was self-isolation was recommended for 14 days for all persons who may have come into contact with persons infected with the virus or had traveled in the affected area. And then we see on the 13th, the 14th, the 15th of January, subsequent reports starting to come out from mostly Thailand, played a crucial role here, and then South Korea and Japan around what they were observing and what they'd been detecting. And I'll come back to that later. But there's lots of debate right now about what the World Health Organization did or didn't do. And I'm going to be talking about this in a moment. But I think it's really important to just remember that within the space of 4 weeks, we went from a country informing the international community that there was something happening. And within 4 weeks' time, we had declared that this was a public health emergency. And from that moment forward, now there's been over 70 updates from Director General Dr. Tedros on what should be happening in response, what states should be doing to prepare, to test, to contain, to isolate this outbreak. I'm going to put in the comments here, if I can. I know that it's not open, so I'm going to put here a link. So in your Q&A, hopefully you'll see that, to the COVID-19 dashboard. And the reason why I want to show that dashboard is to show where we are at today. And if you scroll along on the COVID-19 dashboard provided by Johns Hopkins University, you'll see there's a screenshot of active cases. And those are the active cases occurring in the world right now. And I think we can see very clearly why this pandemic meets the definition and the terms of a pandemic. It is widespread. It has crossed all borders. There is very little area of the world that has not been affected by this outbreak. And it is, as Caitlin said, affecting all of us, our lives, our relationships, our incomes, our sense of security. It is pervasive in the way in which it's affected how we think about. And what I've been casting my mind back to is an event that I was, a consultation that I was asked to take part in August 2018. In August 2018, World Health Organization had set up an extra budgetary program. So a lot of you who've been following what's been happening with the United States funding of the World Health Organization will know that the World Health Organization has core central funding, and then it also has these extra programs of funding. So these are ones that states want to fund. And this was one to which I've been invited to attend, which was on influenza, vaccinations, production and supply chains in low and middle income countries. And the purpose of this inquiry and commissioned report, to which I was part of a panel that was called upon to talk about trade, law and diplomacy, was to look into how could we upscale the production and supply of influenza vaccines in peacetime, in lower middle income countries, with the objective that should there be a pandemic, and in August 2018, the indicators were, we were due one, it was 100 years since 1918 Spanish influenza. Whatever was going to come was most likely, it was considered, going to be an influenza. And we know that has had some devastating consequences for countries who think coronavirus is an influenza, and it's not. And that the vaccination would be the only thing that would be able to ensure that there wasn't that kind of economic, political and health system devastation that was being predicted at this event that I was at in August 2018. And I was asked specifically about the likelihood of cooperation around a vaccine. So the argument was that we had to identify existing means of cooperation, existing areas within, particularly for me, Southeast Asia, where there was ramping up of vaccination usage, where there was a ramp up of vaccination production and supply. And I was asked to talk about whether or not I thought cooperation was possible. And I, gave forward a whole heap of different types of scenarios and how we could plan for it and think ahead of it. And I remember a very seasoned UN official looked across at me and said to me, but at the end, when it comes to the crunch, Sarah, and I'm going to ask you this, when it comes to the crunch, do you really think that states are going to cooperate? Do you really think if there's that one vaccine, that there is not going to just be a desire just to shut down, produce it, and own it all? And I at the time said, I think we can overcome it. I think we can, with the knowledge that we have had since SARS in 2003. We know our health security is determined by not just the health of our own system, but the health of those who are coming into the country and by the health of those within our wider region. It's essential for our economies. It's essential for our sense of regional security. And I've been thinking a lot in the last 6 months. Was I wrong? Was I wrong to underestimate the degree to which the sovereign pull, the national interest, the rejection sometimes of the science and the information that is coming in? Also the degree to which too, a lot of our systems were sort of set up with the expectation, as evidenced by that meeting that I was at, that we were going to be dealing with an influenza type pandemic, and that would mean that there was already the expectation that vaccination supply, production and supply could be upscaled from what we're already doing on a seasonal basis. But I do think it's really important to talk about the challenges, to talk about, for me, whether or not I was wrong, but also to identify the fact that I think the last 6 months have demonstrated that we do possibly have a problem at the moment with the international institutions through which we are seeking and expecting to achieve health security. I think the challenges actually are quite immense. And if I'm wrong, I'm glad to be wrong, but I don't think we can overestimate what challenges we have before us at the moment. I think in hindsight, we're going to look back and see that some of these political challenges were starting to emerge before COVID. I think COVID has definitely amplified them and given them a fast forward. I also, though, I'm going to say that I think it's important for us to find the positives within the last 6 months. I think they are there. They're small and they're fragile, but I am going to talk about them and introduce them with the hopes that we can focus on those maybe as the pathways to break through some of the challenges that I think we are collectively around the world facing at the moment. And so I want to start, because I think it's appropriate in July for us to talk about the announcement by the World Health Organization, by Director General Dr. Tedros this month, that there is going to be the creation of the International Panel for Pandemic Preparedness and Response that was agreed upon by the World Health Assembly back in May, one of the few moments of international cooperation that we've had in the last 6 months, where it was agreed that there should be an independent panel set up to investigate the response of WHO to the initial stages of the outbreak, as well as the long-term operationalization of the World Health Organization's international legal mechanisms in response to health emergencies like COVID-19. And the expectation of this panel that has been set up is that it is going to be operating in live time. It will be delivering an interim report in November and a final report in May next year. And one of the reasons for that is because the World Health Organization sincerely believes that we are probably actually maybe only at our first curve or just emerging into our second curve. And there is going to have to be a need to update and continually ensure that the response of our systems are being reviewed. And this was in fact the demand of the World Health Assembly member states. Helen Clark, former New Zealand Prime Minister, and Ellen Johnson Sirleaf, the former President of Liberia, have been set up to chair this panel. And it's very important to note, World Health Organization has had independent panels like this after public health emergencies like Ebola in West Africa and the Zika outbreak in Brazil before. But this one is being chaired by 2 former politicians. So it's quite a step change here. It's high profile political individuals, not necessarily health or scientific individuals. So the intent here is to try and work out how to progress, not just the mechanisms, the technical details, but the political cooperation. And Helen Clark, when asked about this panel, said in response, well, I think the greatest threat that we face right now is not the virus itself, it's the cooperation. And that repeats something that Dr. Tedros said at his announcement of Helen Clark and Ellen Johnson Sirleaf, where he said the same, we face a lack of leadership, we face a lack of solidarity. That's why I think every individual should be reflecting upon the fact that the tragedy of failing to cooperate is leading to the loss of lives. We cannot defeat this pandemic as a divided world. And when Helen Clark was asked, what has she been surprised about with the lack of cooperation, she identified, in her words, an international cooperation failure. She said that there's been a lack of UN Security Council coherence in response to COVID-19. There's been a lack of that declaration of the outbreak as a threat to international peace and security, which had happened with the Ebola outbreak in West Africa in 2014. And in particular, there have been a lack of efforts by leading states, particularly the G20, to try and organize and coordinate a response in the way in which they did try to do so, particularly after the financial crisis, But we also saw efforts by the Group of Seven to try and even coordinate some sort of response to SARS, coordinate a response to H1N1, and coordinate a response to the Ebola outbreak. So first of all, I am going to take us through these challenges in a little bit more detail and see where I think they're happening. And maybe we can then have a conversation about why these challenges are arising. First of all, I think what we're seeing here at the moment is a challenge in our multilateral organizations. And in particular here, what I would identify is the United Nations Security Council, not because I think the United Nations Security Council called for a resolution on COVID, if it had happened back in April or may have necessarily led to events transpiring differently. But I think what the lack of mobilization within the United Nations Security Council symbolizes is the deep divisions that are occurring at the moment amongst the leading states to which we normally turn to see some kind of global consensus in response to a crisis like this. The UN Security Council couldn't even agree for a number of months to agree to the terms of a resolution that would specify a ceasefire amongst warring parties around the world. So that resolution, just calling for a ceasefire, identifying that the COVID-19 required warring parties to agree to a ceasefire, took a number of months. We didn't get that resolution till the 1st of July. And when you read the resolution, you see that it's quite bland in its recommendations. It's a call for 90-day ceasefire amongst combatants. It calls for humanitarian access to humanitarian crisis, and it notes a number of groups that it identifies as being particularly vulnerable and who need to be considered as priorities in the COVID-19 response. And we see that the tensions and the disappointment in that ceasefire resolution is then followed 9 days later with the fact that the UN Security Council then adopted a resolution on humanitarian access into Syria that didn't maintain humanitarian access in this humanitarian crisis. They actually reduced it. The Security Council on the 10th of July, 11th of July, adopted a resolution that reduced open border crossings into 5 million people desperately in need of humanitarian assistance, including food and medical supplies, now had that 2 roads access reduced to 1. We see in G7 and the attempts, in particular by Angela Merkel, a repeat failure to be able to bring the Group of Seven and to bring consensus among the Group of Seven on a statement on what should be done in relation to COVID-19, and the same with the Group of 20. We also see within the World Health Organization a systematic attack on the head of that organization, Dr. Tedros, and on the people who are working within that organization, from the country office in China through to the scientists who were part of the first executive committee that were brought together by 15 different countries, so representatives from 15 different countries, attempts to try and attack and identify some sort of political preference that swayed them on what position that they adopted in response to the first information about the COVID-19 outbreak. And we see those attacks come from the United States, but we've seen them also come from China. We've seen them come from Brazil as well. And so I think, again, what we're seeing here is not that these organizations and institutions haven't had a history of intense scrutiny and politicization. Of course they have. But what we're seeing in this instance is a failure to, even in that first moment of crisis, to find unity. And in fact, what was always, particularly in the area of health security, and my understanding was that it was in these moments of crisis that you could sort of achieve nominal cooperation to at least respond to the first outbreak or to respond to the first threat. We're failing in this outbreak even to achieve that. And I am concerned about that. I think what's also concerning about the challenges at the moment is the long-term consequences of what's happening. So because of the failure to get consensus around cooperation and consensus around what are the cooperation priorities, is it vaccine production? Is it testing? Is it ensuring that there is some sort of strong system support for PPE? So we've seen the World Health Organization and the United Nations repeatedly sending out these calls trying to rejuggle what they see as the priorities. And I think those repeated calls where you see this rejuggling and this refinessing of what they see as the priorities for funding is coming because we're looking at about between 10 to 23% of the total appeals that have been asked for have been funded. 23%, between 10 and 23% have been funded. So there's a mass underfunding. The Red Cross has indicated that only 10% of the budget that they're going to require for 2020 due to COVID-19 has been funded. They're operating without 90% of their funds. Even before the outbreak of COVID-19, we had 63 countries that were in direct need of humanitarian assistance due to disaster and ongoing conflict. So we were entering into 2020 with a high volume need due to the mass displacements and the ongoing protracted conflict situations. And we're seeing that those funds weren't coming through. And then on top of that, the COVID-19 is adding extra demands on that funding. And in fact, the United Nations Organization for Coordination of Humanitarian Affairs have said that their real concern is that the demand for coronavirus funding, a necessary funding, is going to displace all the finance that they needed for pre-existing crises. And what we're seeing at the moment in June, July, is this outbreak starting to enter into, in quite a pernicious way, it's really taking hold now in some of those areas where already were undergoing extreme humanitarian deprivation. The other thing that I'm concerned about at the moment is the debt. So because again, we haven't had a G20, we haven't had that kind of mobilization that we saw after 2008, 2009 with the financial crisis. We've seen a massive rise in national debts. National debts at the moment are rising rapidly. The World Bank within the first couple of months issued $50 billion available in grants and concessional loans. And the concessional loans is really important because what we don't know at the moment between the World Bank as well as the IMF, which has lent over $20 billion to help with the COVID-19 outbreak, is we don't know the terms of the loans provisions, and we don't know how much of these loans are being issued as opposed to grants. So there's again, there's a sort of, if you like, a doubling concern here that's emerging at the moment, which is that there's been a failure to coordinate amongst donor countries what should be the terms of loans and what should be the terms of grants and what should be the percentage of grants and what should be the percentage of loans. And so what we're seeing is an upscaling in states just having to borrow money because they need to. And this is ranging from low income to middle and in some cases high income countries having to borrow massive amounts in order to sustain themselves through this crisis. And there's a lot of concerns then around what type of austerity and what type of repayment measures are going to have to be introduced and what impact will that have on the attempts that we're trying to make to alleviate some of the extreme poverty, to ensure that food security and health security, so universal health care, that these types of provisions are not sacrificed to try and get through the COVID-19 response. You know, this has been one of the biggest concerns at the moment, is that health systems are coming under massive pressure. Health systems that had just started to make gains and were starting to get their vaccination rates over to 90% of the population. We're starting to get maternal mortality numbers down. And what we're seeing is already within the last 3 months now that the measures are coming in, we're seeing that some of those access points, those really key important areas of gains, have been reversed in the lockdowns. And the worry is can they make a V recovery or will they actually tailor off into more of an L shape? And this is the worry. I think the other thing that we're seeing at the moment where we do see coordination is around vaccine discovery. But even here, my concerns is that we're seeing high volume private sector and philanthropic interest in vaccine, but that is not state cooperation, and we shouldn't confuse the two. CEPI, for example, the Bill and Melinda Gates, which is funded by the Bill and Melinda Gates Foundation. This is not an international cooperation mechanism between states. This is a board that is put together that has access to states, and states can be part of it, and Norway was a key member of it, but it's not the same as a coordinated agreement. And this is something that the United Nations General Assembly resolution in 74274 in April 2020 identified, that we still haven't actually achieved an international coordination facility amongst states for the COVID-19 vaccine. And the reason why I'm worried about this is because we saw the reports about Russia trying to gain access to information on vaccine research. We know that there's been lots of reports around how states are already trying to secure their own production and supply if the vaccine is discovered within their country before they share the vaccine on. And I think beyond just the immediate issues around production and supply in an equitable way, we also have, we know at the moment, a rise in anti-vaccine sentiment. We have to face the reality that there will be large numbers of populations that may reject the vaccine, even if it is available. So we may not achieve herd immunity. We know that demand is a serious problem. If we look at COVID-19, one of the big problems has been the production and supply of existing medical commodities. So sexual and reproductive rights, in that space, anyone who is needing access to sexual health commodities, so an intrauterine device or the pill, in some countries, they were down to single digits in May and June, single digits of what stocks they had available to issue to populations in need, because there had been issues with production and supply, primarily from China and India, due to the lockdowns, and then lockdowns around the world in some of the ports. So if we think about that in the context of vaccine, and if we know that even if we're at a second wave or a third wave, there could be repeat lockdowns, that could also have an impact when we're thinking through our production and supply and distribution chains. We also know that in the testing space of COVID-19, there have been buyouts of some of the key ingredients required to do COVID-19 testing. So South Africa made a call, for example, in May, arguing that they needed to gain access to some of the essential supplies to put together the tests for COVID-19 that they were being blocked from accessing due to failure to cooperate in this space. So if you think about there, we can't even always guarantee supply of goods for testing. I really do genuinely worry what we're going to be facing if we do manage to get a vaccine. The other area that I have been really concerned about has been the normative pull of the sovereign. We're seeing aid discussions at the moment pull back to the national interest. We're seeing health diplomacy and health aid being used as a tool to manipulate or to drive home particular messages around a state's efficacy, a state's position as a health security agent. Yes, I'm referring to China here, but I'm also even referring to perhaps our own country, Australia. Where we're talking about now aid in very clear national interest terms. We're not shying away from it. We were already pivoting that way, I think, but what COVID-19 has done is really take the direction now towards donors will talk, I think, and start to articulate quite clearly now about the relationship between aid and the national interest in a way that rights groups in particular had been trying to mobilize against, to ensure that we were keeping in mind that while sometimes aid needs to be distributed according to the national interest, there's also a need to consider about need as well. We see that security spend, and this is in the context of aid has held steady as a proportion of GDP for most OECD countries, but security spend is on the rise, massive. 2019 was the largest annual military spend in a decade across the world. And I think we're going to see that more so now, not less. So I think on top of all of that, what we saw as well in those immediate couple of months was we can talk about the countries that were ready to prepare. And there are a number of countries where it's quite important to note that they were ready. In January, February, they had their tests ready. They were already taking steps to respond. But I think it's also important that we talk about the instinct of a lot of states, including those who were ready, was to guarantee their own PPE, their protective equipment supply, was to guarantee their test supply, was it when they could to lock down borders and to start to put conditions on travel, which was against, at the time, the World Health Organization advisory around the international health regulations. So the instinct again of countries was to not cooperate, was to lock down supply. And I think we haven't yet established to what extent those trade and travel restrictions were possibly effective. The view at the moment is that they were, and so we need to have a reckoning around that, the reciprocity consequences in the next outbreak. If states see that trade and travel restrictions work, what will happen next? We also have to look at, again, the fact that it will be remembered that the instinct was to lock your equipment and to lock in what you had in terms of testing. We're also seeing at the social level, the proliferation of digital technologies to track movements, to track people, and the legitimization being attached to that, that this is a role of the state that perhaps we have to accept, and that's going to have massive human rights implications. We're also dealing with, in some quarters, the rejection of science, the rejection of science based on information silos and infodemics, such as 5G creating COVID-19. And it might be the instinct to laugh or scoff that, but I think these are really important reactions that we need to keep in mind, because it links then to trust in vaccine, and it links also back to what role the state will have to adopt in order to make sure that populations who reject the science are secure for everyone else. And then we've also seen some very important fundamental divisions within our societies around the economic versus health argument, and the creation of it as a powerful choice that you have to make. And that's not just been in the Australian context, that's been in Indonesia, that's been in Brazil, it's been in a number of countries where there's been serious conversations and debates because of the precarious economic position some of these countries are in.
Sarah,
so
5 minutes.
Yes, so
okay.
Now I'm going to do the positives, because I like to try and end on a positive after all of that. I think the positives are three, and I'm going to go through them. I think human rights institutions have been, and at the normative level, human rights have featured in this pandemic. As a person who's been studying health emergencies now for 17 years, 15 years, human rights has been front and center amongst some very key actors in this response. It's been front and center throughout the United Nations in ways that haven't always been there in the past. So we've had the United Nations Secretary General, the United Nations High Commissioner for Human Rights, and of course the WHO Director General, who didn't always pass these roles, didn't always link health security and human rights in direct ways in which we've seen here. Talk about women's rights, domestic violence, disability care, access to information communication technologies during lockdowns as a human right, the considering of economic rights of people affected by furlough schemes or in highly dense urbanized settlements, refugees and migrant workers. The rights language during this pandemic have been really, it's been remarkable, as I said, and I've studied this for a while, and it really has seen this groundswell of civic participation as well, linking the rights to the pandemic, talking about ethnic minorities, migrant workers, low-income people as being high risk of this outbreak. And that conversation has been really front and center, and it's been quite important, I think, to acknowledge that this has required confrontation with the inequity in our societies and in the low, middle and high income countries. I think international surveillance at some level here has worked. When we're talking about the international health regulations, and that's the instrument that we use to get state cooperation in response to a disease outbreak, it's important to note we've had 188 countries report COVID-19. There have been delays. There have been sometimes delayed countries threatened to stop doing testing and stop reporting. But it is worth thinking about the failure to report is in a country such as Turkmenistan or North Korea. That when we've had delayed reportings in a situation such as Indonesia, or when we've had Tanzania, for example, say they're not going to report anymore, it's been popular, we know it's happening, we know what their choices they're making, and there's a direct effort to try and identify, in the scheme of things, a minority of countries, it seems at this point, that are deliberately trying to not report. I think it's important that we think about, however imperfect surveillance and reporting is, that this is a shared system that has been worked at very hard now since SARS 2003, but especially since H1N1, the swine flu, to try and finesse and improve and normalize states report what they're observing on the ground to the international community. And I do think that there has been some important gains made in this area. Finally, I think what we really need to talk about here is the positives of our science institutions and the cooperation that we have seen here. Thailand, Chungkhlorn University, in the middle of January, mapped the virus sequence. South Korean universities then followed with that at the end of the month. Due to the mapping of that virus sequence, and then the open data release of that, we were able to scale up PCR tests, and a number of countries got in early to prepare. We have 180 vaccine trials occurring around the world right now. If we could achieve some form of an international cooperation around production of supply, you think about the type of cooperation that is in place right now to get that knowledge, that information, those trials out. We saw it happen with the Ebola vaccine, which has been crucial in trying to stem that outbreak in Congo at the end of the last year and the beginning of this year. We've also seen what technology can do when it wants to. You know, Twitter, look at this seminar tonight, you know, look at what Zoom's been able to achieve. Look at what Twitter and Google have been able to dedicate in terms of space and time to make sure that who issued health advice comes up first whenever a person types in COVID. So there is potential, there is opportunity for cooperation. And I don't think we should forget or dismiss these positives. We need to think about how they can become, those small windows can become maybe doorways into opportunity for international cooperation. I was going to briefly talk about the Australian case and its pivot towards the Indo-Pacific, and in particular its focus on Indonesia, Timor-Leste and the PNG in this response. And I think these are really important moves that we've seen. Indonesia at the moment is seriously struggling with this outbreak for a number of reasons. The Philippines is as well. And I think we nearly need to be thinking about what can be done in this space to assist our neighbours with this outbreak. I think ASEAN has not actually scored too badly in terms of the way that they've tried to achieve some form of cooperation in this space. There's not been a lot of observation and talk about it, but there has been a lot of work going within ASEAN Secretariat around coordinating health ministries to share information and to share National Standing Committee findings, to share civil defence cooperation planning and response, and to share risk communication analysis. The ASEAN Intergovernment Commission for Human Rights issued an important human rights release around what they think should be the human rights priorities for ASEAN states. The ASEAN Women and Children's Commission have done likewise. So I think it's really important that we identify and capture those areas where there have been real effort. And it's interesting to me that Australia, in the last month, Maurice Payne has been talking about a desire to really foster more cooperation with ASEAN states in the health security space. But we do have tensions up ahead for this region as well, with elections in some key countries and the ongoing China-US tension. So Caitlin, would you like me to stop there? I have a little slide on conclusions, but I don't have to do it. I can just go straight to questions.
Sarah, thank you. I think we probably can go to questions. We've got a few building up, and I'm going to steal the first if I can. And really, I wanted to just bring your focus again, you touched on the issues facing women in particular across the globe, and you've written fairly extensively on women as being disproportionately impacted by the virus right around the world, but it's contextual. You know, do you see, should some of our international organisations, I'm thinking of the UN, I'm thinking of the G20 in particular, when leaders come together at the end of the year, should they be honing in on these kinds of issues, and in particular on particular vulnerable communities, and identifying strategies for those communities?
Yes, so I think one of the things that has been one of the things that we identified, a group of us with the World Health Organization, was that we thought that there was quite a slow reaction to identifying the fact that there's an absence of sex-segregated data on COVID-19, around 47 now, over 50 countries out of 193 odd, regularly collect sex-segregated data on COVID-19. So what that means is that we have a number of gaps in our knowledge around the effect of this outbreak on populations. And it's particularly important because when we're thinking about care roles, healthcare worker roles, and, you know, there's been that famous book that was done on women's sizing of PPE and how PPE doesn't really provide them affection, but we think about 70% of our healthcare workforce around the world are women. Yeah. And so what we're seeing at the moment, particularly, is that there is disproportions in terms of jobs that you do and risks that you face with COVID-19. So the vast majority of the jobs that we have that have had to keep going during this outbreak are primarily staffed by women around the world. So we have a sustained, but on this other hand, the lockdowns have compromised their access to care, and in some cases their rights to advocate for job conditions. So we have a whole bunch of scenarios going on here at the moment that are really harming and impacting on the health security of women, but also on top of that, affecting the way in which our societies are managing and responding to this outbreak. So one of the things in my project we found is that women were sometimes making early choices about employability and access to hours and jobs, and were missing out on important furlough schemes, or were not in a position of negotiation around their wages, which meant that they may have been locked into conditions of employment that were quite dangerous and harmful then during this outbreak. And that's across a number of countries that we've been looking at. So one of the things that and then of course, the lockdowns have had a massive impact in terms of family violence and then access to ongoing healthcare services. So we have suggested that there needs to be a real focus in particular on the Sustainable Development Goals. And in particular, there's a need to really think about what threats COVID are going to have to some of what we call our core goals of the Sustainable Development Goals, one of which is SDG 5 around women's equality. And we can see in those goals already, within the targets within that one, we are going to see significant impacts in terms of women's access to sexual and reproductive services, women's access to economic independence, and women's protection from violence against women. It's also important to point to there are some gender stereotypes out there that are harmful for men as well. So we thinking about this COVID outbreak as a response, and also the economic aftermath, because again, one of the things that we're seeing is that it seems to be at the moment, from Malaysia to Australia to the United States, women are more likely to be the economic losers after this, or during the recovery, for the reasons I've just been talking about.
So it's really fascinating when you talk about the challenge of leadership, and I so appreciated the fact that you mentioned leadership and cooperation are actually there, but not necessarily where we expect to find them. And so our leaders actually have to be thinking at the big high level, but also at a level of granularity that maybe they haven't had to in the past. Now I'm going to come to some of the questions we've got. The first comes from Marcel, who is asking for your view, or if you can comment on the claims made from various quarters that the WHO is unduly influenced by China.
That's a great question. Thank you, Marcel. Okay, so there's an excellent report. It was actually a journalistic one that was done by James Meek at the London Review of Books, and looking into where this kind of rumor of tetros as being in the hands of China came from. And it seems, I mean, I knew it also, it sort of originated with the very contest itself for the World Health Organization Director Generalship, when Dr. Nabarro, who was the UK citizen, was seen as the favorite, lost to Dr. Tedros. And there was this sense that not only did African nations wanted to back the first ever Director General from their continent, and that seems to be something that people can't understand why they would want to do that. But then there also seems to be this suspicion attached that because he is an Ethiopian citizen, and we know that Ethiopia has been quite, a high recipient of Chinese funds, that this tainted his election. I mean, I think, to be honest, China was never going to perhaps support Dr. Nabarro. Okay, so we need to kind of first just let that go. But I think that has had this that fed into the rumor mill in this first instance. I think the release of that Associated Press report in June was no accident, right? So the fact that we got access to a lot of the internal dialogue that was going within the World Health Organization at the time, I think indicates that there's no evidence that Dr. Tedros was holding his fire because he didn't want to offend China. He was holding his fire because he wanted to keep the information door open to China, because he knew that any delay with a virus that was already out, okay? It was already out. They knew by this point it was out. They needed to keep the door open. Now, the question is, was the diplomacy wrong? Was that diplomatic attempt wrong? Or do we think that he should have gone hard and fierce, named and shamed? People point to Gro Harlem Brundtland and SARS in 2003 and say, she named and shamed. She didn't actually. She waited a good four to 6 weeks before she called out China for not sharing information. So again, I think we need to look in the timeframes here. He acted very fast. I think Bruce Aylward was the problem for who? When that famous interview that he gave on the question of Taiwan, and then that press conference he gave where he just lavished praise on China. Those were the things that I think really damaged actually the World Health Organization more. I think there are bigger questions to ask about how the World Health Organization manages diplomacy with states that don't want to release information, how it manages these trade and travel restrictions. They've not issued notices to Australia and New Zealand, and we've both done them, So I think, there are some bigger questions there that actually we need to be asking of the World Health Organization. And I think not this one.
Well, actually, you've just hit on the next question from Connor about whether you think Australia, among other countries, disobeyed the WHO's advice regarding travel restrictions. Should they have thought of a different path?
It depends on whether or not you thought trade and travel restrictions were ever going to be obeyed in the first place. And then it comes back to then whether or not you thought that what was important about the inclusion of this into the revised international health regulations was about trying to deliver a notion or a principle of reciprocity. Things can't be arbitrary. And the key word in that restrictions is arbitrary and prolonged. And so I think what could be argued at the moment, or what could be challenged, is that this is not arbitrary. Though it kind of did look like that at one point when Australia just did some and not others. But it also about prolonged. I think the coronavirus COVID-19 has tested actually what public health people thought they knew as well. And so international health regulations was this attempt to try and get this legal instrument that had some promise of reciprocity so that a low-income country with high rates of endemic and infectious diseases would not be constantly slammed by this instrument, compared to a high income country with a very strong health system. And this was the attempt to try and get everyone to sign on board. I think the promise of it, or perhaps the underlying expectation of it, was not that it would always be obeyed. There would be an attempt to try and obey it most of the time, and that in those low-income countries, there would not be this constant arbitrary trade and travel restriction placed on them. So I think, and that was the concern, right? If you have a country that's constantly reporting particular types of diseases that appear on the annex of the AIIA, they would be constantly getting hammered. Yeah. And so I think perhaps where we didn't think it through, or wasn't thought through at the time, was the fact that we would have to be going from all, so no one has anything attached to them, to nothing. And so this is the conversation at the moment is, have we made it to one or the other? We maybe need to have a scale or a phase so that countries can move along in a crisis like this and see where they sit, where their risk is, and we try and shuffle everyone along a bit more, rather than just saying you've breached the law or you're complying with the law, when complying with the law sometimes isn't what we would recommend at the moment, and breaching the law in some cases can be unfair and arbitrary. So it's a great question, I think. Yeah.
And lots of learnings to come out of this experience that hopefully will apply to the next. I've got another question about Scott Morrison having stated, oh, actually you've answered this in relation to the independent inquiry. So I might leave that one, sorry. But I will come to the last one. And you did talk about how we've seen a real step up in our defence spending over the last few weeks. Last week we saw that DFAT cut a number of jobs, and diplomacy again has been subject to the continual impact of efficiencies and offsets that have really undermined in some ways diplomacy, which sits at the heart of the cooperation that you're talking about. What kind of an impact, and this question comes from Brianna Bailey, what kind of an impact do you think these decisions are going to have?
So the cutbacks on DFAT means that you have a staff that were already operating on quite a low, doing a lot of work with not a lot of person power, and now having to do a lot more work with less person power. I think it probably would be very, very hard if you're in DFAT to be seeing those cuts and seeing the rise in spending in other areas, particularly in national, in the security space and in the weapons procurement. I think on the other hand, though, what probably this points to, though, is the medium to long-term battle that we're going to have around trying to promote the aid portion and the engagement and the public diplomacy and the important areas of cooperation that emerge from our development and shared cooperation programs that we have been doing in the region. So there was a lot of concern, right, when AusAid was taken out, was folded into DFAT. And there was an attempt to try and articulate, well, no, this is actually about delivering, value for money. So our foreign relations are connected with our aid, and that's going to really, advance how we connect in the region. And I think if you look at the health security program under the Indo-Pacific Centre for Regional Health Security, there's some truth to that. There is an alignment there between trade, research, and aid. But I think the problem is how much do we expect all these people to do, in terms of they've got one job, and we've probably added about 3 to 4 portfolios now to their one job.
That's right.
And so I worry a lot about and how we maybe are not connecting the dots. While yes, it's fine to be pivoting and thinking about the rise of China, and to be thinking about protecting our borders, and to be thinking about making sure that we can maintain open supply and access in our sea routes, I think we also need to be realizing, though, that we've got partners in the region who we also need to have with us, and we need to make sure that we are engaging in a moment like now to be cooperating and to be reaching out, not just to the ones in our immediate periphery, but some of the ones that maybe are between China and us, a little bit closer to China, and not assume they're gone. Yeah. Not assume that we can't still have opportunity to build really important relationships with those countries as well.
Now, I know I'm stretching our time a little. I've got a question here from Brendan, Griffith student. Thanks for the shout out, Brendan. But he's referred to the fact that you mentioned COVID-driven ceasefires in conflict zones. In your opinion, do you see COVID as going to be a major deterrence for large-scale interstate conflict in the near future?
Interstate conflict. Note, not intra.
Yes.
Possibly. I wouldn't want to say, I mean, we did have the Indo-China skirmish, right?
Yeah.
In the height of an outbreak. And, you know, we still don't quite know what happened there, but we know the deaths were definitely in the double digits. So I wouldn't actually want to say no. I'd like to say we won't, but I wouldn't presume that we couldn't. There was a lot of terrible worst case scenario planning when HIV/AIDS, and we can't remember it now, but back then there was a lot of really bad research done. My apologies and my love to those. But a lot of attempts to try and connect HIV to emergent national security threats, and that, you know, we're going to have militaries infected with HIV and going to combat and to war with each other, and there's, you know, all these sorts of things. I don't want to go down that path with COVID-19, but I think what I worry about is if trade routes are undergoing pressure, if we've got emerging rifts and higher debts and little scope for repayments, and we're asking countries to start choose on whose side they're on. And I think we are now. I think we're really starting to ask countries to make choices. My worry is that we're going to increase the risk for misunderstandings, for opportunities for cooperation to very quickly escalate into something else. And so I don't think that COVID-19 necessarily will cause it, but I do think that there's a soft correlation there.
And living in a global pressure cooker. We haven't even talked about Trump, but I know there's a great YouTube conversation between you and Sophie Harmon all about Trump and COVID, and I'd recommend to everyone to look that up on Google, because I think when you're looking at certain types of leadership, we've got a fascinating example there. Look, one final question from Graham. Should we be lobbying our MPs with respect to the international response on COVID?
That's a great question, Graham. So I think, what would we lobby them for? I agree. I think what we could do is maybe capture back what Caitlin said at the beginning, and we start to identify particular areas that we don't want to be lost in the conversation. So the Australian government, in doing their DFAT report on the preparedness for the COVID outbreak, made it a suggestion in this report all the way through that they identified so that report is the Partnerships for Recovery, the Australia COVID-19 Development Response. One of the things that they talk about in that report a lot is regional cooperation, and that they think regional cooperation really matters, and women's inclusion, women's representation and women's inclusion, and that health security is an individual-centered objective. It obviously is connected to ensuring that there's things like universal healthcare coverage and these sorts of things, but it's also about identifying populations at risk and identifying them as part of the recovery. So I think it would be actually really useful to go through that report, highlight the bits that we all like, and send them multiple times. It's who we think might be open to us sending them multiple times.
And I think that's a great point to finish on, except I do want to note we've had a question from Jenny and a comment about international students in Australia, and we know that they are vulnerable as well and facing discrimination, and maybe we can include a reference to them in our lobbying of MPs, and just think about the international students in our lives and our communities that we can support through this.
Absolutely. And I think, you know, there were also, for me, coming back to cooperation and what the positives, the science for me is one of those areas, you know, where, and I take a broad church view of science. I include, you know, social science in there as well. And I think, you know, one of the things that for me in this outbreak was being the emails, the conversations that I've had with Griffith alumni and with other students who I've known through the years who are right now responding to this pandemic. Those kind of relationships and that kind of exchange are the things that are right now informing Australia's own response in Indonesia, in PNG. And I don't think we want to dismiss the important relationship, the long-term relationship we have with our international students. It's not just for 3 years. Hopefully these relationships can be long and enduring partnerships. And I think, you know, that's the other thing we need to focus on with COVID-19.
Absolutely. And look, thank you, Sarah. It's been, you know, as expected, this has been just such a thoroughly professional and comprehensive discussion about the impact of COVID-19 on our international relations over the last 6 months. And I think, you know, it is pretty gloomy. I've got to say, it can be really disheartening to be listening to you go through some of those real challenges we're facing, but also incredibly positive to hear that there are some glimmers of hope, whether it is around cooperation, whether it's around our increased attention to human rights and vulnerable populations and populations at risk, and how we as individuals might be able to play a role in really advocating for those we know are in those groups. Let's hope the next 6 months shows a little bit more positivity going forward. And look, I want to thank you for your time. You are in demand, and it's a really, it's very generous of you to spend time with us tonight. And I'd like to thank everybody in the audience, you know, for taking your time on a Tuesday evening to, you know, really engage with some incredibly important issues of our time. There'll be more information on the website about the forthcoming events that we'll be holding. I know there's one coming up on women in international affairs, so please look out for it. And in the meantime, thank you very much, everyone. Enjoy your evening, and we look forward to catching up again. And Sarah, thank you so much again.
Thank you. Stay safe, everyone. Wash your hands. Take care.